Around 4 years ago, I was diagnosed with a chronic condition known as inflammatory bowel disease, also known as IBD. There are two forms of this, one known as ulcerative colitis, which is the one I was diagnosed with, and the second being Crohn's disease. Both of these diseases affect the GI tract and cause ulcerations from the stomach and down. They can cause inflammation, they can cause mucus buildup, but I will get a little more into detail about that later on. My main goal is to inform people of the importance of seeking aid when noticing symptoms and changes in daily life. Noticing these small changes always have a larger significance in allowing people to figure out that the disease can be treated much early on before it gets more severe. And I would just like people to know a little more about it. Since 2018, I have personally been seeking specialists involving my diagnosis of ulcerative colitis. Personally, ulcerative colitis is what I am a little more informed about since that's what I was diagnosed with, but Crohn's also falls underneath the same category, so both the symptoms and the treatment are similar in that aspect. Ulcerative colitis affects the large intestines and down, all the way to the rectum, and Crohn's disease can happen all the way from the liver all the way down to the rectum, so anywhere in the GI tract. Information from my specialists, Dr. Chan and Dr. Beasley from Gainesville, Florida Medical Plaza, have been amazing. They have provided me with plenty of information that I can help other people know and lead on to. What I would like to inform people about this disease is that how the diagnosis process goes, how the treatment process goes, and a little bit of the daily life of how people manage with it and what happens after the fact that you've been diagnosed. The importance of any chronic disease is to vitally let people know about the greater knowledge of this health risk and their well-being. The information I present to you about IBD is aimed to hopefully allow you to learn more about it and to seek the help if you need it. Personally, it's been a long issue for me, but it's manageable. So, information from the CDC of symptoms that are common with both of them are persistent diarrhea or sudden urges to use the bathroom, abdominal pain, rectal bleeding, and bloody stools, which is what most of the time will lead people into figuring out that, oh, that's what I have. And once they go to the specialist, that's where they will be diagnosed. Many of the times, like these initial instances of seeing the blood in the stool or the very severe abdominal pain, seeking a primary care doctor, they will do a sequence of blood work tests and lab works, but if they do not find anything that they are knowledgeable about, they will send you over to a specialist. Once you're at the specialist, they will do a series of other blood works and labs, and once they get those results, they will lead you on to getting an MRI, a colonoscopy, and an endoscopy. A colonoscopy is where they enter from down here and go up into your GI tract to see how many ulcers or what's happening. An endoscopy is a camera going down your throat to see how your upper GI tract is going. There is no real known cause for this disease. There are many specialists and researchers say that the environment, genetics, what foods you eat, and daily life can cause or affect it. After diagnosis, a plan for treatment is discussed, starting off with simple coating pills, which is how I began. But since my severity got worse, I had to go up to from the coating pills to injections weekly, which is also a case for many people. If the severity of this condition gets so extreme, there will be a need for surgery where resectioning of the bowel will be done to remove the inflamed or infected part of the lower intestine, as in small intestine and large intestine. Daily struggles, for instance, after diagnosis and treatment, people will go into remission and not feel symptoms for a long time. Some people can go for months to, like, from weeks to months without feeling any pain, but the pain can come back, and that's known as a flare up, while others may go up to 10 years without feeling any feelings of like flare up or ulcers or inflammation. Um, there are no pros to having this condition. However, it is slightly better if you are diagnosed with ulcerative colitis over Crohn's, only because ulcerative colitis is specifically from the large intestine down, where Crohn's is throughout the whole stomach, like I mentioned before. The cons to this, there are many cons to having IBD. Um, Specifically, having higher risk of cancer, blood clot, low iron deficiencies, and all that other kind of stuff, but that's still manageable with the healthcare that you get from receiving diagnosis. And overall, this is just a simple basis of what I have learned over the years and what information I have gathered from learning all of this stuff over the years. So hopefully this is enough information to get people knowing a little more about this disease and to vitally get them informed of more diseases, hopefully in the future, so that people know when the symptoms are happening and when they can prevent them.